Hi, my name is Maggie Strasser, and this is my D029 Phase 1 reflection. Um, so as a nurse already, I did not take in consideration what kinds of technology have advanced in the time that I've been a nurse and the type of technology that will continue to advance. Healthcare uses a lot of technology, as we know, and there's always improvements to it. Before I was in my current role, I was a device nurse, a cardiac device nurse, and I mean, just the advancements in those specific devices, the timing, the features for reducing heart failure in pacemaker dependent patients with those devices, the monitoring that could be done. They had like Boston Scientific, their specific device had heart failure logic, which could measure like extra fluid, if there was extra fluid in the patient, and we would give them calls. If their number was elevated, it kind of told us, hey, this patient might have extra fluid on board. So we would be able to provide Lasix to them or to increase their Lasix or diuretic to reduce the risk of hospitalization if they were starting to have a CHF exacerbation. So some of those technologies are crazy, and even in the time that I worked in that role, the advancements that they had a leadless pacemaker that was really new. Medtronic came out with that. For, again, those patients would be pacemaker dependent. And even just, working in EP, electrophysiology as an EP nurse, was pretty cool. And that technology is crazy. But now I work as a primary care triage nurse, and I work from home, and we do still use a lot of different technology to communicate with my peers, communicate with the patients. We use the patient portal to provide education, and a whole bunch of resources to help our patients. And I've worked in this role for about 1.5 years, and even since I started, some of those advancements and those specific technologies have improved quite a bit. So when I was doing research for the evolving technology, one thing that was very interesting for me was telehealth. This was also the main piece of discussion in my interview. The implications that improvements in this specific technology have for improving access to care is unmatched to any other type of technology. So in my current role, the patients who we serve typically live in rural areas. I work for a large hospital organization throughout Indiana, but our specific region is they're very rural areas. So a lot of them live out in the country, are farmers, and they typically make a long drive to see their primary care doctor. Having improved telehealth technology for this patient demographic is life-changing. I work for Indiana University Health. They already provide different avenues for telehealth, including virtual on-demand visits, which is like virtual, I describe it to patients as like virtual urgent care. So they basically just get on, and they're assigned to a provider, and they just wait in their living room or wherever to see a provider. We also offer virtual primary care visits, and even our home health company can provide equipment for vital signs, which transmits patients' daily vitals to their office for review. So just these 3 examples of telehealth have provided easier access to healthcare for our patients and have allowed providers to identify health concerns earlier, reducing the number of hospitalizations and poor outcomes. If our healthcare systems continually work to improve this technology, meaning providing more at-home point-of-care testing, finding easier ways to schedule and speak with a medical provider, or even providing easier access to at-home patient education material, our medical system will see even further reduction in hospitalizations due to early intervention and education. So the other technology which showed up on my research was artificial intelligence, or AI. AI recently has been talked about a lot in our society. I found two different articles which spoke to the role of AI in healthcare. So the first one spoke about how it could help providers gather data on a patient, rationalize the data, and then provide the medical providers specific diagnosis potentials based on the data it gathered, and provide different treatments for the diagnoses it provided. So to me, that's kind of cool because it might be able to provide a different view after looking at the patient's clinical picture and help identify other treatments for their specific diagnosis. The second article spoke about the way artificial intelligence has provided the healthcare industry with the Internet of Things. I didn't really know what the Internet of Things was, but the Internet of Things is the ability of sensors, medical diagnostic devices like X-ray, MRI machines, things like that, and even medical monitors to connect to the internet to provide medical providers patient information. Some of this is already kind of occurring in healthcare, but AI is starting to play a role in that area. So the AI portion of this allows this data to be transmitted from one place to another without human interaction. So a lot of times, like, you have to have a person, especially like I know in our X-ray, the person takes the X-ray and then has to actually like manually transmit it from the X-ray to whatever cloud so that the radiologist can read them. AI would reduce that by just making it happen. The AI technology has a lot of different things that it can do. So it'll be very interesting to see where this piece of technology could go, and how it could benefit the patients and providers.